السلام عليكم. تحياتي وتمنياتي للجميع بالصحة والسلامة, especially fourth year medical student, Qadisiyya University. We are going to talk today about the presenting problems in liver disease. How could patients with liver disease present? He could present with either acute liver injury, acute liver disease, or chronic liver disease. Acute liver injury may present with non-specific symptoms of fatigue and abnormal liver function test, or with jaundice and acute liver failure. So it's either mild or moderate, just non-specific symptoms with abnormal liver function test, or he may present with severe form of acute liver disease with jaundice and acute liver failure and fulminant hepatic failure. Chronic liver injury. What's the meaning of chronic liver injury? Is defined as hepatic injury, so any hepatic injury, inflammation and or fibrosis occurring in the liver for more than 6 months. If it exceeds 6 months, this is chronic liver disease. Chronic liver disease. In the early stages, the patient can be asymptomatic with fluctuating of abnormal liver function test. So even patients with chronic liver disease may be asymptomatic or symptom free, and he just present with fluctuating abnormal liver function test with more severe liver damage. The presentation can be with jaundice, portal hypertension, or other signs of cirrhosis and hepatic decompensation. What are the causes of liver disease? Acute liver injury or chronic liver injury. It may be due to hepatitis. As I mentioned, that the commonest cause of liver disease is hepatitis, and the commonest cause of hepatitis is viral hepatitis. So the majority of cases of acute liver injury are due to viral hepatitis, mainly type A or sometimes type B and E, while type B and C causing chronic liver disease and even liver cirrhosis. So type A and E, it's very unlikely to have chronic carrier state, or he lead to chronic liver disease and liver cirrhosis. Only acute liver injury. Alcoholism may cause both chronic and acute liver injury. Drugs, for example paracetamol, for example during suicidal attempt with ingestion of high dosage, may lead to acute liver injury with acute liver failure and fulminant hepatic failure. While non-alcoholic fatty liver disease, hemochromatosis, may lead to chronic liver disease. Wilson disease can cause both acute and chronic liver disease. Alpha-1 antitrypsin deficiency and cryptogenic unknown idiopathic hepatitis may lead to chronic viral hepatitis and may lead to chronic liver disease. Autoimmune liver disease, if it started and acutely, may lead to acute liver injury, and if the process exceeds 6 months, راح يدخل بالchronic liver injury and chronic liver disease. So it can cause both. Autoimmune hepatitis can cause both acute and chronic liver injury. Primary biliary cirrhosis, primary sclerosing cholangitis can lead to chronic liver disease. What are the presentation of patients with liver disease? How could he present? He may present with mild or moderate symptoms. He may have severe symptoms or very severe symptoms. Mild or moderate in both acute and liver and chronic liver injury may present with just abnormal liver function test. While in severe form of acute or chronic liver injury, he may present with jaundice, and if he have chronic liver injury, he may have signs of liver cirrhosis plus minus portal hypertension. And when the patient have present with very severe acute liver injury, he may have مثل ما قلنا acute fulminant failure or acute liver failure with massive liver necrosis, for example. Is very serious condition with high mortality. Or he may present, if it is very severe, with the chronic liver disease. He have chronic liver failure. He may have jaundice, ascites, hepatic encephalopathy, portal hypertension, and with variceal bleeding. Now, our main topics today, we are going to talk about liver cirrhosis. What is liver cirrhosis? It is an irreversible end result of fibrous scarring and hepatocellular regeneration. So there is fibrosis, scarring, and regeneration, characterized by diffuse hepatic fibrosis and nodule formation due to inflammatory, toxic, metabolic, congestive. Metabolic causes may be toxic causes, inflammatory طبعا كما هو hepatitis, or even congestive insult يعني مثلا congestive cardiac failure. All these may cause chronic liver disease and liver cirrhosis. Inflammatory, toxic, metabolic, and congestive insult. Liver cirrhosis حتى نقول هذا cirrhotic liver, it is a histological diagnosis. يعني we have to have a liver biopsy ونشوف السكارينج والفايبروسيس والديستورشن of normal liver architectures حتى نقول هذا cirrhotic patient. إذن هو a histological diagnosis can occur at any age and is the most common cause of portal hypertension. بعدين راح ناخذ lectures about portal hypertension. راح نشوف إنه majority of cases of portal hypertension is due to liver cirrhosis. إذن هو most commonest cause of portal hypertension and its complication هو liver cirrhosis. Liver cirrhosis causes distortion of the normal liver architectures that distort the hepatic vasculature bed, causing portal hypertension and portosystemic shunt with impairment of liver function. It can be classified histologically انقسم قسمين، أما micronodular cirrhosis or macronodular cirrhosis according to the size of the nodule. If it is about 1 millimeter in diameter, it is typically micronodular, seen in alcoholic liver disease, alcoholism. While if it is large size, more than 1 millimeter in diameter, this is macronodular cirrhosis. It is a larger nodule of various size, seen usually with infectious causes of chronic liver disease, مثلا hepatitis. إذن المicronodular occur in alcoholic liver cirrhosis, while macronodular may occur in other conditions, for example, chronic hepatitis, chronic viral hepatitis. This is a normal liver architectures with the right lobe, and this is the left lobe, and this is the falciform ligament. This is cirrhotic liver with nodular liver. Very obviously it is nodular. This is micronodular cirrhosis, its size 1 millimeter in diameter, and this is a larger nodule, so this is a macronodular. هذا اللي نشوفه بالalcoholic cirrhosis. وهذا other causes, for example like infectious causes of hepatitis. So this is a normal liver with a nodular liver, and this is a cross-sectional, فراح نشوف loss of the normal liver architectures with fibrosis and scarring. What are the causes of liver cirrhosis? As I mentioned, commonest cause, especially in United States or United Kingdom or in other European countries, the commonest cause is alcoholism. Number 2 is chronic viral hepatitis. بالنسبة لنا احنا commonest cause هو viral hepatitis، نخليه on the top of the list, especially type B and type C اللي نشوفه carrier state ونشوفه chronic state. Non-alcoholic fatty liver disease, third important cause of liver cirrhosis. Immune causes, for example, primary sclerosing cholangitis and autoimmune hepatitis, autoimmune liver disease. Biliary causes, for example, primary biliary cirrhosis or secondary biliary cirrhosis and cystic fibrosis. Secondary biliary cirrhosis, for example, during, trauma to the biliary passages during exploration of the common bile duct during surgery. It may lead to fibrosis and scarring with later on secondary biliary cirrhosis. Genetic, for example, hemochromatosis and Wilson disease and alpha-1 antitrypsin deficiency. Cryptogenic, idiopathic, unknown cause. 15% of cases of liver cirrhosis, there is no clear underlying etiology behind the disease. so we label it as cryptogenic. Chronic venous outflow obstruction, for example, congestive cardiac failure or constrictive pericarditis or Pacchiari syndrome. It may lead to chronic venous outflow obstruction with congested liver, and finally he may have cirrhotic liver. Any chronic liver disease may cause liver cirrhosis. So this is the most commonest cause of liver cirrhosis. The spectrum of non-alcoholic fatty liver. He's not alcoholic but he has fatty liver. هذا يبدي عندنا fatty liver اللي نسميه احنا steatosis, just fat accumulate in the liver, or with the accumulation of fat he may have inflammation فنسميه steatohepatitis. NASH, non-alcoholic steatohepatitis, so there is fat accumulates plus inflammation. With the time, with the scar tissue replacement, he may lead to cirrhosis. So with cirrhosis, this is the third steps. طبعا هنا steatosis يقولون هو reversible. هنا non-alcoholic steatohepatitis usually end with liver cirrhosis. Scar tissue replaced liver cells. وهذا هنا راح نشوف الفات globules histological examination. This is the fat globules with the inflammation. NASH, liver steatohepatitis, non-alcoholic steatohepatitis, and this is the loss of normal liver architectures with fibrosis and scarring replacement. This is liver cirrhosis, cirrhotic liver. So the stages of liver damage, starting with the fatty liver, then liver fibrosis and liver cirrhosis. What are the commonest presenting features of liver cirrhosis? The clinical presentation. Clinical presentation is highly variable. The disease may be completely asymptomatic. يعني ممكن يجينا المريض ونكتشف انه هذا cirrhotic liver. He is completely asymptomatic or symptom free, discovered accidentally مثلا during surgery. نفتح بطن المريض مثلا ونشوفه cirrhotic liver, or postmortem study, or during ultrasound examination أيضا ممكن نلقوا في cirrhotic والpatient هو asymptomatic. Other presentation هو isolated hepatomegaly, splenomegaly, signs of portal hypertension راح ناخذها in details, and hepatic insufficiency. إذا patient may present with enlarged liver, enlarged spleen, ولا هو commonest presentation of liver cirrhosis هو small and shrinkage liver size. Other non-specific symptoms include weakness, muscle fatigue, muscle cramps, weight loss, anorexia, nausea, vomiting, and upper abdominal pain and discomfort. Cirrhosis may present with shortness of breath. إذا عندنا طبعا hypoproteinemia ممكن يصير accumulation of fluid in the sacs, for example in the abdominal cavity sinusitis, or in the pleural spaces فيسوينا pleural effusion. So he may present with shortness of breath due to large right pleural effusion with hepatopulmonary syndrome. مثل ما قلنا commonest liver usually small and shrinkage in chronic liver disease and liver cirrhosis. But we have some condition, for example alcoholic liver disease or congestive liver disease or hemochromatosis. هنا راح نشوف hepatomegaly with liver cirrhosis. So hepatomegaly is a common when the cirrhosis is due to alcoholic liver disease, congestive heart failure for example, and hemochromatosis. Progressive hepatocyte destruction and fibrosis gradually reduce the size. So commonest راح يجينا small and shrinkage liver size, and the disease, as the disease progresses, in other causes of cirrhosis. The liver is often hard, irregular, and non-tender. طبعا tender hepatomegaly راح يكون اما مثلا secondary عندنا deposits او بالcongestive heart failure ايضا يصير عندنا tender hepatomegaly. Jaundice is mild when it is first appear. طبعا عندنا specific features راح نشوف اكثر شيء بالalcoholic liver disease مثل parotid enlargement, testicular atrophy, decrease in libido, loss of hair. هنشوفه وين بالalcoholic liver disease. اذا parotid enlargement are most common in alcoholic liver disease. Pigmentation مثلا hyperpigmentation especially in hemochromatosis, ولو معظم cirrhotic patients finally with prolonged cholestasis, you may have أيضا generalized hyperpigmentation. Endocrine changes are noticed more readily in men who show loss of male hair distribution and testicular atrophy.